During pregnancy, birth or breastfeeding, babies are at a high risk of picking the HIV virus from their mothers. Research has, however, proved that this can be eradicated, especially if the pregnant women follow the doctor's orders. But before that, they have to meet the doctors and know their HIV status, especially during the recommended 4 antenatal visits. But even better, they must have known their status before starting a family. Sarah did not get this opportunity. At 21 in 1990, she had her first baby, and in 1993, she got her second. A month after the second child was born, her husband, then 25 years old, got bouts of tuberculosis and never ceased being sick.
And they asked how I knew. I said I had tested after seeing his signs.
Her husband got infected through an injection when he was still young, knowledge which his family kept from him even after he decided to marry Elizabeth, passed on in 1996 at 28 years old. Elizabeth lived with a fear of not knowing her children's HIV status because an intervention like prevention of mother-to-child transmission, PMTCT, had not yet been discovered in the early 90s. Her 2 children are HIV negative. But how was that possible?
I breastfed them without giving them anything else. But now with this PMTCT knowledge, I believe it's true a child can't get infected.
The exclusive breast milk without other feeds saved her 2 babies whose HIV status she finally got to know when they had turned 10 and 13. With the introduction of PMTCT in 2000 by the Minister of Health, her other 2 children born in 2000 and 2007, fathered by another man, were closely monitored right from the time she was pregnant, during delivery and breastfeeding, and she delivered in Mulago Hospital.
My babies were given nevirapine syrup, and I also took nevirapine. I also took them for constant checkups at 6 weeks, 3, 6 and 9 months, and by 2 years all was well.
It is possible not to breed a new HIV generation of children while still babies, and the aim is 90% reduction in mother-to-child transmission of the virus. But how about the adults and youths who are not infected? Is the ABC strategy still relevant? New approaches have been introduced.
It's no longer just the abstinence alone, or the being faithful alone, or the condom use alone. A combination prevention is a strategy that uses many approaches. Abstinence, being faithful, condom use, medical male circumcision, prevention of mother-to-child transmission, ARVs for prevention, and then structure behavior changes like reduction of multiple concurrent partners. And look at this community that is most at risk. Counseling and testing as a way of entering into HIV/AIDS services. Those who are positive, providing them with ARVs for prevention. Those who are negative, providing them with different condoms, safe medical circumcision.
A 2011 report on the global HIV/AIDS response released today, developed by WHO, UNICEF and Unaids, indicates that increased access to HIV services has resulted in a 15% reduction of new infections over the past decade. There is hope, and by 2015 new infections may be eliminated. Florence Nalimba, NTV.